And talking about the situation in Nigeria, the Center for Disease Control and Prevention has confirmed 39 cases of Mpox in the country. The NCDC says Nigeria is expecting 10,000 doses of the Janus vaccine as it considers the vaccination for high-risk groups for Mpox. We have more in this report.
The alarming increase in Mpox cases is due to a new strain of the virus, which emerged in eastern Congo and has since been detected in Kenya, Rwanda, and Uganda. So far, about 2,863 confirmed cases and 517 deaths across 13 African countries have been reported this year alone. In Nigeria, a total of 39 confirmed cases with no deaths have been recorded across 33 states and the FCT from January this year. The Nigeria Center for Disease Control says it is putting all port health services across all 5 international airports, seaports, and land crossing borders on high alert.
We are working with the port health services. Along this line, 5 designated international airports and some key seaports, including land and foot crossing borders, have been placed on high alert. Declaration forms have been distributed to airlines, especially those coming in from countries where there is an ongoing outbreak of Mpox in the last 90 days. Treatment protocols and diagnostic tool protocols, according to the IDSR, are now distributed to various states. All states have also been put on high alert, including Lagos, Abuja, Enugu, Kano, Rivers State, Cross Rivers, Akwa Ibom, Adamawa, and Taraba.
The Disease Control Agency also says the National Mpox Technical Working Group will continue to coordinate Mpox response activities across the country.
The exact reservoir of the virus is still unknown, although rodents, squirrels, and monkeys are suspected to play a part in transmission. The Mpox virus can spread from both animal and human, and animal to human, and also from human to human.
The World Health Organization had declared the ongoing Mpox outbreak as a public health emergency of international concern just about 24 hours after the Africa Center for Disease Control declared it a public health emergency of continental security due to an upsurge of cases in the Democratic Republic of Congo and a growing number of countries in Africa. Kemi Balogun, TVC News, Abuja.
A medical laboratory scientist, Kasme Faye, joins me now from the Federal Capital Territory for more on this development. Mr. Faye, thank you for joining us on The World Now. We're looking at about 39 cases spread across some 9 states in Nigeria. What more do we know about the new variant of this virus? Mr. Ifeanyi, I'm asking what more do we know about the new variant of the Mpox virus?
Well, okay, because your volume was quite faint. My name is Dr. Kashmir Ifeanyi. I'm the National President, Association of Medical Laboratory Scientists of Nigeria. Talking about what we know about the new variant. Of course, the new variant just emerged, and it's been evaluated. It will be sequenced fully to be able to appreciate the genetic variant properly. But having said that, what we do know is that it is a lot more virulent than the ones we had. You know that the Mpox has its origin to Africa. And one of the outbreaks of 2023 was even traced to have originated from Nigeria. And of course, we are conversant with the information that the Nigerian Center for Disease Control had put out. Between January and now, we have more than 39 cases, but that's as reported by the National Center for Disease Control. And to show how virulent and worrisome this particular outbreak is, the NCDC Technical Working Group is upbeat to deal with this. But there are areas of disconnect. You know that Mpox is a zoonotic disease in the first instance, but environment plays a lead role in its ability to, to become an outbreak, because you notice that this is about the peak of the rainy season, and since it is a zoonotic condition, some of the animals that harbor this disease are beginning to leave their natural habitats to make incursion into places where humans can come in contact with them. My only concern is that capacity for the diagnosis of this particular disease, the Mpox disease in Nigeria, is still very, very low. All credit to the National Center for Disease Control for what they are doing in that regard. But because, very many states, including the FCT, and then Ogun State and Ebonyi State, have been reported. Of course, Bayelsa is in the lead of states with the number of cases in Nigeria in this particular recent outbreak, followed closely by states like Ogun and Ebonyi State. And so it's important that we continue to build and strengthen laboratory capacity for its detection. And it's also important we educate healthcare workers on indeed how to symptomatically identify people presenting with this, because the symptoms sometimes would mimic shingles, would mimic herpes, and can even mimic measles that occur in children. And we do know that children and pregnant women are a very vulnerable group for this disease.
Dr. Ifeanyi, we have completely run out of time, but I'm surprised to hear you say that our capacity for diagnosis is still pretty low, saying how well we performed with the Ebola and COVID-19 outbreak. Briefly, if you can, what do you think is the challenge here? Is it a matter of infrastructure?
Oh, largely, you know that most states in the country do not have laboratories that are capacitated and, of course, purpose-built to deal with this kind of outbreak, because, you know, this is a viral outbreak, and the diagnosis is not commonplace. It is basically polymerase chain reaction, which is a molecular testing technique, and molecular testing technique had not become commonplace in all the states in the country.
All right.
That is why it is still the NCDC that have continued to provide characterization and definition for this outbreak and the level of detection. So subnational government, state governments should begin, particularly states that have been mentioned in this recent outbreak, should begin to think of how to strengthen laboratories in their state with abilities and facility. Of course, we talked about infrastructure and equipment for molecular testing to dictate not just Mpox, but all such other outbreaks, including Lassa fever that has ravaged the country. And I'm particularly happy that conversations around vaccine is ongoing, which is one of the innovations coming from the Honorable Coordinating Minister of Health, Professor Ali.
I'm afraid we have to go now.
I think also we need to do a lot of discussion about the vaccine.
We're going to continue this conversation subsequently. National President, Association of Medical Laboratory Scientists of Nigeria, Dr. Kasmir Ifeanyi, thank you for talking to us on the program this evening. Well, that's the word now, everyone. You can watch it, get all the details